Hi, beautiful people. If you watched the previous videos, I would want to say you are the best. In today's video, basically, I'm going to introduce to you the myths or misconceptions of breast reduction. This might be my last video to talk about breast reduction. Maybe if anything else arises or anything else comes through, and I would really want to talk about it. The reason as to why I'm doing these videos, I basically get people that ask the same questions over and over again. So I found it so wise if I create you a video whereby you have a reference. You can go back and watch it and get the full concept of everything. Today I've brought you myths or misconceptions or what people really think of these surgeries. Yeah. We have negative ones, we have positive ones. We have things that are really wrong and people think that they are right. Omuntu akkiriza nti okola surgery eno you're supposed to be this. Oba okola surgery eno it will bring you that. Today I've come to clear the air, and in today's video, please stay around, listen to it. My name is Mr. Ricky, in case you didn't know, and if you didn't know, we have the MedMic podcast whereby we get to talk about different topics and get to talk about different stuff. In today's video, let's troubleshoot, let's go through the myths. Myth number one, people think that people do these videos because of looks. A person is there outside is thinking a person who has come through for breast reduction is basically coming through because that person wants to look nice. The answer is yes, that person might want to look nice, but also you should get to know that people do breast reductions to relieve back pains, to relieve neck pains, to relieve shoulder pains. Yeah, people do breast reductions to improve on posture problems. If you watched my previous video, you know what I'm talking about. Yeah, so people do these surgeries, this surgery in particular, for medical reasons. Then number two, you can't breastfeed after surgery. Oh my God, I've received that concern a lot of times. A lot of times. Most people think once you do a breast reduction, actually tojja kuddamu kuyonsa, which is not right. So many women can breastfeed actually after a breast reduction has been done. That's why you need to get a professional to do your breast reduction surgery. Yeah. It doesn't take away the mere fact that, yes, if it is done wrong, you can actually fail to breastfeed. But here we come in and tell you, you have chances of breastfeeding again once you have a right person to do your surgery, and if the person that you've chosen to do the surgery chooses the right technique. We have different techniques, of course. We have very many approaches. We have the inverted T, we have the lollipop. So it depends on really which kind of technique your surgeon has used that will serve you for the future. But here we are saying it's not right that people that have had breast reduction will not breastfeed. Very many women breastfeed after breast reductions. So that is a myth. It's not right, not at all. Yeah. Another myth, there are no scars. Preferably, I'll proudly tell you that after the procedure has been performed, after the procedure has been done, there will be scar formation. But the question is, will the scars remain forever? The answer to that is these scars, once they form, they keep on disappearing with time. They keep on disappearing with time. And the good thing about it, right now, we have very many techniques on how we can prevent them from happening. Yeah. For those that have skins that form hypertrophied scars, we have approaches towards that. We give you a shot of Triam-K, triamcinolone, to prevent the hypertrophying scars. For people that form keloids, uh, we have ways on how we can go about it. Still, we give you a shot of Triam-K, yeah, triamcinolone. So we have very many ways on how we can really prevent the scars from happening, but it won't take away the mere fact that scars will form. However, the good thing about it that they will keep disappearing within within a specific period of what? A specific period of time. Yes. Then another thing, breast will never come back, or breast will never grow back. That is also another concern. Very many people think that once I do a breast reduction, sigenda kuddamu tegajja kuddamu gejja. My dear, mkwano. That's why when you come through, we ask you this question of when are you expecting to receive a baby again? When are you expecting to get pregnant again? Because it wouldn't make sense for you to come through to do your breast reduction today and then within 3 or 4 months you get pregnant. That means you're going to disorganize everything that you did. Now, let me give you 3 factors that contribute towards disorganization of your cosmetic procedure. We have weight gain. Once you gain weight, remember the breast is surrounded by fats. The breast tissue is made of fat, yeah? So weight gain, once you gain weight from the way that you did your procedure on. If you did your procedure when you were small and then you gain weight, that means there is a possibility of you what? Disorganizing the results. Pregnancy. We all know pregnancy attracts weight. And actually, your hormones, the progesterone, the estrogen, all the hormones within your body enhance in order to prepare for the incoming what? Incoming baby. And you have these hormones that work around the boobs, yeah, that helps in secretion of milk, the estrogen and progesterone. So that means once you get pregnant, your results are going to get distorted. Amabeere go gayinza okuva mu size gye wakola ki gye wagakoleramu. Then we have hormones. Hormonal imbalance. Yeah? So once we get hormones that are hyper, that are way above the normal, they can stimulate regrowth of breast tissue. They can stimulate regrowth of breast fat. Hence, you're disorganizing the whole what? The whole procedure. Then there is this myth, yo, that doing a breast reduction may cause cancer. Oh my God. So most people think that once you do a breast reduction, it increases cancer risks. Let me tell you something that is so nice. Actually, when you do a breast reduction, you are reducing on your chances of getting cancer. Did you know that? You are basically reducing on your chances of getting cancer. So it's the other way around. Most people think once I do my breast reduction, ngenda kufuna cancer. Era bangi mukumwe bajja musawo sigenda kufuna cancer. Teri cancer. Let me tell you one thing for sure. Once you do a breast reduction, you're actually reducing on the chances of you getting the cancer. Then another myth. Most people think that the process of recovery is too painful. Get someone that has had a breast reduction. It's never that painful. Now, let me tell you something. From the time of you doing the surgery, it is done under anesthesia. That means you're not feeling pain. When you have gotten off the table, you are managed by painkillers. No pain. All through recovery, for the first 1 week, you are given painkillers. No pain. So tell me, why are you going to find pain? The pain that you can only get, it's supposed to be within the first few days after the surgery is done. And it should be manageable, it should be mild. Yeah? And most people think only women need it. No dear. Breast reduction, actually, even men need it. For men that have gynecomastia. Gynecomastia in men, if you've seen my previous videos, yeah, you've seen them. Men also need these surgeries. For men that do have gynecomastia. Then any surgeon can do it. Don't you ever think that any surgeon can give you this breast reduction? No.